Okay, I'd like to call this meeting to order for March 10th for the Health and Human Services Board. Roll call, please.
Kay Wilson,
Here.
Tweed Schuman,
Here.
Marshall Savitsky,
Here.
Chuck Van Netten,
Here.
Jeff Haney,
Here.
Lorraine Gauger, Don Pettit,
Here.
Pam Mueller is excused, Dr. Dunlap. She's virtual, right?
Yep.
You have a quorum.
Let's stand for the Pledge of Allegiance, please. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God,
indivisible,
with liberty and justice for all.
Do we have certification of compliance with the open meeting law?
This meeting was noticed to the public and the media as required by Section 19.84 of the Wisconsin statutes.
Thank you. The meeting agenda has been set. There is no public comment unless someone online has something to say. Okay, let's consider approval of the minutes from our previous meeting.
I'll make a motion. I'll second that.
Motion's been made and seconded to approve the draft minutes from February 10th to 2026. Any further discussion? All in favor?
Aye.
Opposed? So carried. Do we have anything from LCO?
I did not receive any updates.
All right. How about from the Senior Resource Center?
There's a written report.
Report is as written.
Marshall
All
may
right.
want, Marshall may want to comment.
Let's see, there we go.
I don't have that.
This was added today at 3 o'clock.
Oh, okay. I'm like, I just printed it out late, but I didn't print it out that late.
Does anyone know what this Adopt a Senior is?
Yeah, I do. We had an idea in the fall, late fall, to have a program where people could adopt a senior and sponsor them to pay for Meals on Wheels for them. And that's in the final stages. Joey's identifying people in the most need, and then she's going to match them up with someone in the community that will pay for meals. The idea was if you had lost a relative, that like a grandparent, and you wanted to do that for Christmas in their name, that was kind of the idea that started it. It hasn't fully developed all the way, but she's working on it. That's what this is.
Is she advertising that?
I don't know if she's at that stage yet.
Okay.
The last time at the last meeting, she said that she was identifying the people that you could sponsor. But that was, it's right here. So yeah, she said she has one sponsorship in the name. So I don't know if it's publicized. Do you want me to ask that question at the next meeting? I'm on that board.
Yeah, it would be interesting to find out about that program because I think it's well worth pursuing.
Okay.
I think it's interesting that 94.5% are female that are getting meals.
Do you have something?
How does that come out with 38% are male? That doesn't quite add up.
She'll get some.
And then I remember from the, because I'm on that committee too, but they, like if you adopt somebody, you can set a time, like if you're gonna do it for a month or 6 months or a year, depending on, what it costs and everything, so.
That would be good to find out.
Yeah, we could actually put that out on our Facebook page.
I lost the,
Did you lose your agenda?
yeah.
Do we have any printed?
Oh, thank you. No, I have it right here.
Okay.
All right. Let's move on to, do you have anything for the organizational chart tonight, Julia?
The org chart's in there, but I do have a couple of updates that I'm gonna share screen for. Maybe. Okay, so, whoops, I'm gonna take over sharing. Okay. Oh,
Do you need me to do that for you?
I need, oh, yep, that's what we need up here. Ooh, that did not, that's teeny tiny. Here, let's see if we can figure out.
Bring binoculars next time.
Welcome to my world. I have it there big.
Oh, why is it not?
That's just, the screen sharing is always smaller.
I see.
But I have it.
Okay, let me see if I see what she's doing. Here, it's on my side. There, we can make it huge.
Let me get this.
And move this over. Okay, so we have had some changes really recent, so we don't have a lot of information. Last month, I announced that Joe was going to be back on with us as a limited term employee for mental health clinician. As you know, we're focused on CCS. However, also during the last time we were here, we talked about the children's, oh my gosh, supportive services supervisor, I'll get it. We determined that after Lisa Nasser was leaving, that we would put in for the position and as supervisor for both CLTS and Birth to 3. Haley Sands applied for the position, and we offered her the position, and she accepted it. So this is brand new as of Friday. Alicia and I were on a call today trying to kind of get things starting to figure out where things are going to be. So just giving you the heads up there that is happening. And then as we come down through and think about the transitions, Katrina started as a casual and she is willing to go full-time. So that fills that position. We're still needing to do a little bit more hiring so that we can have the appropriate 2-to-1 when we want to bring that other client back. But we're moving in the right direction. We've got some apps in. So when it comes to behavioral health for the immediate focus, and Alicia might have some more things to kind of comment on, but right now, our immediate focus with behavioral health is getting Joe up and running on the new electronic health record because we did not have that when he was here. Alicia is also working on the documentation for CCS. Allison, we already started to do this. So as you go up here, you have Allison Carlson, she's our CST coordinator. Our plan was to get her trained as a CCS facilitator so that we would have 2 facilitators because Haley was also doing CLTS. So luckily, we have started that process of getting Allison trained. And Haley, we'll be working with Haley to be able to, because we have referrals for CCS right now. We're in the middle of getting functional screens set up, getting people onto the program. With Haley leaving, we're gonna have to figure out what that transition looks like, how we can keep moving forward and not stop. And we have some ideas that we've worked through. So I think we'll be able to keep going. It's not like Haley is leaving our employment. She, her transition may just take a little bit longer as we move forward. And
Julia,
then
I think Haley she did the OWI.
Haley did OWIs as well.
And who will be doing that then?
So we're kind of working through that. Joe used to do the OWIs, so we can do that. Other counties actually just shift right out. I think we were talking about, and I'm going to have Alicia speak to this when she gets to her section, because she could probably remember better than I can. But there are some options for actually being just referring out that she has done some investigation, and we haven't made any decisions at all on that yet. We just started that discussion today. So in the meantime, we've got Joe on board, so there won't be any gap in services. It's just how we eventually decide to do the services.
Okay, thank you.
The other piece that is got a highlight on is being able to now see that children's support services, that used to be where Julie was a supervisor of the Birth to 3 program, and Alicia was supervising the CLTS program. Now it will be transitioning to Haley. And she'll become part of our leadership team. Haley also will need to carry caseloads, either for Birth to 3 or CLTS along the way, as the needs are there. And one of the things is our Birth to 3, we are down probably about 8 clients at the moment. We had a bunch of kids turn 3 recently. And we haven't had anybody really coming on board very quickly. So we haven't been out there like reminding people to make referrals because we want to just kind of make sure that we can service everyone. At this point, Jen Sarbeck has that caseload under control. We've transferred everything over from Lisa that are things that have to get done. So we're in okay shape at the moment. So that is my, oops, I don't want to stop sharing, so that's the org chart update.
I had a question.
Okay, I heard you.
Julie, I got a question.
Yes.
Did you recently post an interview and hire for assistant director under you, though?
No, well, Carrie's been with us for 2 years.
Oh.
A deputy director.
Because I had some folks calling me about a position that was available under HHS, and that's.
Oh, you know what? It is admin assistant /
Yeah.
receptionist. That's a clerical position.
Oh, okay. Admin assistant.
Oh, that might explain why maybe we got some people that were way overqualified for that
Exactly.
position.
And several were upset they never got an interview.
Yeah, well,
So, I see.
you want to bring that
I
back?
didn't know that. And I
Yeah,
was-
yeah, they need
They
to.
were calling
like-
me because I'm on the board here. And I
Okay.
didn't know anything about it.
Okay. Most likely that must be, but the job description was very clear that they would be doing clerical work.
And you would think that the salary would reflect.
Oh, yeah, the salary was, yeah, it's very reflective of that, so. Anyways, if you want to push that back, letting people know that that was our clerical support team. Thank you.
Has that position been filled then?
Well, actually, I didn't even think of writing that down, but I think we sent out saying that we have somebody that we'd like to make an offer to. I have no idea where that is at, but
Okay.
that just happened today. So that's all been great. Okay, I have just a little bit more, it's kind of related to admin update and strategic plan that I can quickly go through if we're ready to transition.
Please.
Yes? Okay. Thinking about employee engagement as part of our strategic plan. Last week, we celebrated Employee Appreciation Day, so we had lasagna luncheon for our staff. We've set it up at this building, brought it over to the ADRC building, and then we did a little goodie packet for our new employees at transition. So everybody got an employee appreciation recognition last week. This week is AmeriCorps Week, so we'll be messaging that out tomorrow. We have an AmeriCorps member, 2 AmeriCorps, oh yeah, both the peer recovery, and maybe you'll speak to that on your thing. It's that we'll be looking at. Friday is Spread Goodness Day, so we're trying to do things to engage our staff together, doing something fun and things that are good for the community, things that are positive, and with gratitude. So we'll be just kind of messaging out about Spread Goodness Day on Friday. The following week is Social Work Week, and we've probably got, at least half, if not more, of our employees do some sort of social work. So we'll be celebrating that. And then the last week of the month is National Cleaning Week. So we're going to have a little competition on maybe, who can get their office the cleanest or who's the most remarkable change. And trying to really, take supplies out that we no longer use. We actually are doing this as a county and doing an exchange of supplies instead of needing to go out and buy something. Maybe somebody has something we can swap back and forth, so that's happening. I'm planning for all staff, and I missed that on we needed to do a decision on that. We didn't get it on the agenda, so we'll have to make sure we get it on the agenda for next time. Looking at May 13th for that, so we're doing planning for that training. The leadership team has determined that part of employee engagement is to really get our safety planning and training down. Just some concerns about safety just within the building. How do you navigate, move around? How can you keep yourself safe in your environment? We've been having a little bit more disgruntled people coming in, either, because they don't qualify for benefits or, just different things that happen in people's lives. So we're going to be working on safety in the office, safety related to safe exit routes, even like thinking about fire extinguishers, all those types of things, and then safety in the field. And then finally, I'm really focusing in on HIPAA, AI, and security. I have a training next week in Eau Claire. And then I'm also part of a group that's working on AI policy, and then developing training for all staff when we have our all staff. So that's our main focus right now.
Julia?
Yes.
At one time, we had an active shooter drill. Was that a couple of years ago? Have you had one recently?
We did at our all-staff training, and I think that this is where maybe some more discussion came up, because at our all-staff that we had, the entire county, we talked through all of that. It wasn't like a drill where people were leaving, but I think it got people thinking, okay, how does that work in my environment, and how do I do that? So we're going to be bringing those pieces back to the immediate area. It's one thing to have discussions about it, but then to bring it back to the specific work area you're in is a whole nother thing. So it was good. Great discussions that came up from that all staff. Darren did a great job. I think it just opened up eyes, or people asked their leaders more questions, and we thought that, okay, from an employee engagement, that is a good focus.
Well, it's best to be prepared, because then it won't happen.
Yes, and lots of things are in place to help keep us safe with the secure doors and different things. So, okay, that ends that report.
Okay, let's move on to aging and disability resource.
We don't have a written report in there. Actually, Carol got back from vacation and then ended up falling and breaking her wrist. So she's doing everything through dictation. So that's taking a little bit longer. Some of the verbal updates I've gotten is we're really working through with APS on, and I probably mentioned this a little bit last time, environmental health hazards, homes with hoarding, safety concerns on sanitation, and do people have the environment to live in safely? So those are some of the things that are coming in play when we're thinking about APS referrals. So working really closely together on that. The other piece is training for APS is for forensic interviewing. We have forensic interviewers trained in the CPS world to be able to handle that. So when we lost our forensic interviewer for the county, which was through a children's advocacy center, we picked up that piece, but we really can't support the entire county out of our department. Law enforcement has started to do some of that forensic training, but nobody has completed it fully. We're looking at just a shortened version of forensic training for Rebecca to get trained on, so that when she goes in for APS interviews, she has that better ability to get detail and information. So
What is forensic?
it's a specific style of interviewing to elicit answers to questions without being leading. So
Okay.
and that's really And that, those types of interviews are what can stand up in court.
I think we talked about that before.
Yeah.
Okay,
So-
thank you.
So anyways, so that is what we're doing. Caseloads continue to be fairly complex. We're hearing that all across the region. We've been talking about our aging population and all the issues there. So nothing is changing. That's just status quo. So that's it for the ADRC and protective services.
Moving on to behavioral health.
Okay. Alicia, your report is there. Things are already obsolete from some of it, but do you want to, are there any other updates that you would like to add, given our discussions?
Trying to get my camera. Well, the camera is not working.
No, that's okay.
And, let's see. Somebody asked about the OWI assessments, and we, Joe had done them for many years. I had done them for many years, but nothing stays the same with the state. They changed the way things were being done. So, although I supervise it, I am not allowed to actually conduct the assessments. So the supervisor has to supervise, and you have to have all the whatever credentials, which I have, but then Joe can do the OWI assessments. So that is not an issue. We also have another option where we could surrender our 7515 license, and we could have there is a place called Community Counseling Services. They do the OWIs for Chippewa, Barron, Rusk, Washburn, Price, Jackson, Buffalo, and Trempealeau County. So they basically set everything up with the individual. We would refer them over there. But we're not, Julie and I talked about that today. We have not decided what to do. I think we have to have further conversation on whether we want to maintain doing the OWI assessments at the county or not. So at least for the time being, there is not going to be a break in service. Joe has, 30 years of experience doing them. We've had them in the department forever. So there's no worry there. CCS, yes, a little bit of a setback, but I'm meeting with the CCS administrator tomorrow for the region to let him know what just recently occurred, because Haley was our service facilitator, but I think Julie and I came up with a plan to keep Haley on just to get these two people into the program, because we finally, after all these months, we've got two people that are going to screen eligible, but we'll figure it out. We'll work it out. And looking forward to getting other Sawyer County employees in different departments CCS certified. We also talked about that, so that some of those where they're doing case management and they can't bill for it if they were CCS certified. It's just a different term for case management. If they're doing individual skill development enhancement, they could be billing at a bachelor's level rate, or if they had an associate's degree, it would be a higher rate for stream of revenue that would be coming in. So perhaps even with employees over at Transitions, we could be doing that as well. So it'll be a lot of work trying to get everybody trained and expand, but it's doable. It's just not going to be done overnight. So please bear with us with the changes that seem to be consistently happening, but eventually we will get there.
Thanks, Alicia. Questions?
Yeah, I have a question about that Canes Club after-school program. It's once per week, and there's like 75 fourth and fifth grade students in that program?
And that can vary, Tweed. When I ask Allison, she'll take a count. But yeah, she does that once a week. Sometimes when needed and asked, she may be going up there 2 days a week. But right now we're pulling her back from that because of the changes within my department. So Allison will be getting trained in for, she has to maintain the CST, that's 60% of her time. And then the other 40% would be for CCS. And eventually, if we continue to grow, we will then have to think about hiring another person for service facilitation. Because within CCS, the roles are very distinct. They don't cross over. Everything is black and white. You either can or cannot in CCS, which is very different from CLTS. So we're going to have to just watch how things go, and the more referrals that we get, because we have to make sure Allison puts so much time to that CST grant, because that brings 60,000 in for us. So we certainly don't want it to lose that.
Anything else? No?
Huh?
No? Okay.
Yep.
Okay. Then with the community support and mobile services, I don't think Caitlin's on, which is fine. That's pretty much status quo. Any questions related to that? Okay, and then our typical report is on for those. So nothing additional for me to report on.
Okay, let's move on to Child, Youth, and Family Services.
Okay, for Child Protective Services, we had a pretty thorough report last month. What we're working on right now is end of year reporting. We continue to have monthly meetings with ICW, which I think has been very beneficial. I sit in on those and run those meetings. I think those connections and that communication that is happening there is really bridging some of the communication gaps that we were having. The other thing is that, and actually it's moving a little bit into the YJ world, or diversion world. It's moving into the grant-supported program world, I guess is what I should say. With some of our grant funding that we received in February, we were able to do in-school assemblies at LCO schools, and then at the middle school at Hayward, and at the high school at Hayward. And winter school bused all their students up to the high school for the assembly. We brought in, remember we talked about Tall Cop before, which was something that we brought in for professionals to learn about what's happening in the area related to opioids and other things. Then off of Tall Cop, he doesn't work with the schools or the consumers, so to say, but they have affiliates that work with them, and we brought in one of the affiliates to come in and talk with the kids. It went over really, really well. I think from what we've heard from both the student participation as well as how the schools felt about it. It was a wide array of conversation that happened over an hour. Number one was sexploitation, and really looking at being friends with people on all these different apps. You just like, oh my gosh, somebody wants to be my friend, and I accept them in, and I accept them in, and I accept them in. And then they continue, and then he talked about how, these perpetrators or these men would figure out to eventually get to meet them, or I want to meet you, let's go, and kind of really talk through some of those things and how this happens in a way that was real life, like things that had happened. And the kids' eyes were really opened up quite a bit, especially through that conversation. In fact, they thought that we should be doing training at the elementary level. Like it was too late even for that conversation to happen. So we'll be kind of looking at that moving forward. But he also brought in bullying, had good conversations about that, had conversations about vaping, and suicide prevention. So a lot of topics were hit on. I went and I watched through the high school one, and everybody was well engaged. So, and heard good things along the way. So anyways, I am thrilled that we are able to do those types of things. The school would love to work with us again if we can continue to find funding for this, because these are things that are difficult for schools to be able to put on. So it's a good partnership with that. And then we have the YJ report, which is our standard report. Not much changed on that either.
Who was the presenter for Tall Copper?
We brought somebody in. It's not local.
A paid position?
Oh, yeah, we pay, I think between, we had to pay for flights and different things for that. It was probably $5,000 for the day.
So how long was the presentation?
A little over an hour, and he went to 3 different sites. So, well worth it to get the expertise. And you have to have somebody that can engage.
Do you know what their
audience.
background was? I'm just curious.
He was a law enforcement over the years, and specifically had worked in the schools as their school resource officers. Did you remember, Julie, where he's from?
And no, that's all right.
He's really good. I've seen him a few times when I used to go for trainings, and Tall Copper is good. He knows
Yeah,
his stuff.
anybody who's affiliated with them is really, really good. You were going to say something?
Did they have any curriculum that classroom teachers can kind of continue it on with?
We've really struggled with that with the schools, because there's lots of different curriculums that we can help bring in. But finding the time to get the school to be able to fit that into their day is what we're really struggling with. So if you have some ways of being able to have conversations like that, it's really trying to because there are some key curriculum we would love to see happen. It's just those days are so filled.
When I was in Altoona, we did something similar, and we did schedule in with the rotations like Fayed and that kind of thing. They would spend some time with the guidance counselor going through.
Just in
That
kind of
type of
so
thing.
maybe that's a way that we can work.
It's
in.
important.
I'm looking to Julie because we've been trying to figure out how to sneak different things in here and there, and it's been a
Do
struggle.
the children still have health education or?
Yeah, but it's not the same as what it used to be, Kay.
No, it's very truncated now.
But it's a curriculum that
But
we
it's a-
could maybe,
Yeah, but see,
Jump
their
into?
curriculum is packed. They have that it's weeks long of.
There's so many standards you have to meet. It is
Yeah.
hard to get anything else in. But
Right.
So many meetings.
So we'll keep kind of plugging at that and see what we can do. Thank you.
interesting. Okay, let's see.
We're almost
We can move on to economic support.
Shauna has her report in here. It's our standard report. Nothing additional that I have to report on that. The thing outside of that report that we continue to be good on is our error rate for the northern region and even for Wisconsin. And looking at our error rate, that's important when it comes to later on preventing us from having to take on additional administrative costs related to the Fed cuts. So
Where is your error rate?
it's not on there. I just
Oh.
said that on top of the report. Outside of the report, that's.
Okay.
Yep. It's under 6. And I can get those more included. They kind of come haphazardly, and then I don't think of throwing them in there. But I know verbally, everything is looking good.
It doesn't seem like the calls have jumped.
Nope, pretty consistent.
Yeah. Okay,
I got a question.
yes,
Madam Chair.
I'm sorry.
Julia, how do we get this information out to the public where they can access these benefits? And because I know earlier tonight you mentioned that you really didn't want to put it out there because you didn't have the staff to support
Oh.
what you might get. How do people know about this?
For food shared everything?
Yeah, yep.
That is all out there. I wasn't talking about that. I was just talking about going out.
Birth to 3.
We go out for
Right,
birth to
right.
3 and we go to the daycare providers.
But you were
and
dropping
the
in numbers with
hospitals.
birth to 3, and
Just-
you really did want to put it out there because you didn't have staff to support what could be coming in.
Just for birth to 3.
Right.
Yeah, and it's out, I mean, people can call and make a referral, but we'll go out and we'll go to meet with all of the daycare providers, and then we go and do trainings with the clinicians, and then we usually get a bump up in referrals. So at this point, that would be something that we'd start to work on, but I will hold off for probably 2 months before we start doing that, so that we have people trained in to actually do that. But all of this other, we're all fully ready to go. It's on our websites, Northern Region Consortium. There's multiple ways to be able to call in and get all of the other services. And if somebody, I mean, we have 4 referrals for birth to 3 right now. I was just making note of what we would normally do if we were fully staffed. That's what we would normally be doing when our numbers get a little bit low. Because sometimes it might just be that there aren't kids there, or it might be that people forgot, like, oh yeah, I probably should make a referral.
Okay,
Thanks.
all right. Let's move on to public health. Julie?
Just a couple of updates. Respiratory illness does seem to be going down. Currently, we're at moderate levels for our region. It is decreasing, so that is an update from the written report a week ago. Also, the measles, I did put in information in the written report, but I wanted to let you know we've had 145 more cases nationally confirmed in measles so in the 1 week timeframe. And this week, or actually last week, DHS did put out their vaccination rates for counties for 2025 for the year. And I wanted to highlight that of our 24-month-olds in Sawyer County, 71.5% have had 1 or more measles vaccination, so measles, mumps, rubella, compared with 79.8% of 24-month-olds statewide. So we are tracking under that because of the implications with herd immunity. Just wanted you to all be aware. Having the vaccine, having 2 doses of the vaccine is 97% effective at preventing this disease, and this disease is highly contagious. So just to let you know. In addition, and I will say that 71.5% rate for our 24-month-old residents here is the lowest we've had in 12 years. So as far back as the graph went, that is the lowest rate. So we are doing, we were awarded the RICE grant, and so part of that effort is to send information to parents, and we did a mailing to our residents within the last month. So we are working on that. Our nurses are also working on that to call and follow up with families. As a part of the report that was just published this week, 54.3% of our 24-month-olds have completed the series, so the child recommended series, and that's compared to 66.9% statewide. So we're really trending under, especially in childhood immunizations. We are hopeful that cleaning our data, making outreach to families, we're also providing routine immunizations by consent in the schools as a part of that grant. So hopefully we'll catch more students that way to reduce barriers for parents who might not be able to take off work to take their kids in to get vaccinations. So we are working on that.
Is there a financial burden with that, like one of the roadblocks?
There can be, but we do have Vaccine for Children program, and we are, as Sawyer County Public Health, we provide vaccine for children. So if you qualify, we can give those vaccines with no cost.
Qualify mean income?
Qualify meaning if you're underinsured or uninsured, if you have Medicaid, if you're Native American or Alaskan Native, and there's one more category, I think. or maybe underinsured and uninsured are on two different lines. But if you qualify under one of those groups, we can provide that vaccine at no charge with no administration fee. And we are providing that here in clinic. And this grant, the RICE grant that we were awarded, it was actually our first time that we were awarded this year, and we're working under it now. That allows our nurses to go into the schools and work. So when a parent says, yes, I want my child to be up to date, they can fill out a consent form and we're able to give that. Similar to what we do with the mass clinic with flu when we go in for exercises, but this is based on request. So we're working with our schools in that as well. So just to let you know. Any other questions on that? I did want to highlight one more thing with Birth to 3. I know Julia highlighted a number of areas with Birth to 3, but we did get our Metastar review back, and we fully met the criteria for that. So it was at 85.3%, which is fully met, and we're working through the couple of things that they gave us feedback on. So, but wanted to pass that along as well. Thank you.
Okay. Lorraine, since you were, came in a little late, do you have a report for us for
It'll be short and sweet, but I just want to say a few words.
please?
Is that on? I'm sorry I'm late, I had another meeting, so we just got finished with the other one. And
Could you speak into the microphone?
I just want to apologize for being late, because I had another meeting that I was at, so the roads are dangerous out there, by the way. But I did want to acknowledge those reports that we're getting on vaccination and those issues. It's important for our people to keep an eye on that, because with those cases that we're seeing across the nation and people that aren't vaccinated and the risk that they have there, it's going to hit our community when we see our numbers dropping with the rate of vaccination shots for those ages. So we really got to watch that with the community and to keep them abreast of that. So that was one of the things I wanted to mention, that the clinic is watching things too. We had a lot of rhino cases. We had a lot of, cases like that that we're seeing in the clinic. And we're trying to keep an eye on those kinds of, situations also, because it's continuing. And so we just got to make sure we provide the care and watch what's happening. And we're seeing more like COVID symptoms. And so that's not totally out of the picture here yet. So those who has respiratory issues and how, some that ended up in the hospital with pneumonia, we really got to watch the aftermath, the after effect of what had happened with the pandemic. And we're still in that recovery stage, and it's something we got to continue to watch. And we are moving forward with our supplemental housing project. We're going to the next step now. So we're hoping that things will come together and we can pursue that project and have that built sometime in the near future to provide that support for our people. So that's one of the major ones that we're working on at this time. So any kind of ways that we can help those in the community that are struggling with addiction or struggling or homeless or trying to be reunited with their families, we're trying to address those things in ways that we can. So we're moving forward with that. And I know the elderly unit got their new shuttle bus, so that's going to help transport and get people either to the center or get the things out to the community when we need to, and that'll help. So any means that we can do along that line too, and they're connecting more with ways and training members of the community for care and for ways that we can help that population. They're providing classes at the university and trying to connect more with how we can help our people when they're home and they're, just they continue to have more of that care rather than having them go off somewhere or go to nursing homes, if we can prevent that and continue building in that arena. So that's growing too. So, and then to engage more of the community to those trainings or learning opportunities so that we can continue with that effort, no matter where, whether it be at the center or at the university or whatever site. So, but anyways, I just wanted to mention a couple things. I know I haven't been here. I'm on travel. It's hard for me to be here at times, but I always like to hear what's happening so we can keep an eye on things in the county and the LCO. So I appreciate the information when I am able to be here.
Thank you. I appreciate the report. Julia, shall we move on to fiscal?
Yeah, I think it's so new in the year, it's hard
Yeah.
to really look at the reports, but I do want to just point out just a couple of things on page 42 and 43. So that's going into the 2025 HS receipt recap. Can you see enough to be able to find?
When you say 43, 42, you're talking about in the whole page.
numbers.
Yeah, but here,
Oh, you don't see
I don't see
those.
that, so,
Oh,
yeah.
yeah. We're gonna jump to this.
do you want to make it bigger? You can make it bigger here.
So which one are we looking at? The budget by unit or?
Nope, we're just jumping to the, maybe they have the same problem.
Yeah. This one?
I don't know
This one?
if that's up here. Can I just talk from here maybe? Yeah. Sorry. Okay, can you hear me okay? Okay, so what I wanted to point out, a couple of things that we have done differently this year, have taken on the ability to bill case management in the family services program. So we've never had MA income. So we have about 17,000 that we were able to bring in this year. No, it doesn't sound like a lot, but every penny we can bring in can make a difference. So that is those pieces. In the youth aids, we brought in just over 17,000 in that area as well with those case management dollars. So when Alicia was talking about potentially in other areas where we could get them CCS certified, we could perhaps in some of these case management places be able to transition that to potential CCS billing if we have the right client to be able to get that in there. So that just CCS billing is going to be reimbursed at a much better rate than just straight MA. So that's the next transition. But this was the first transition of being able to bring in funding. And then what else did I want to, sorry, I don't want to be making people sick. Okay, just in the Agent of the State program, noting that we are like well over our projections. Part of that has to do with the fact that we hadn't budgeted for the TRH. So just noting that, but we were expecting that income to be coming in. And then we didn't get a lot here, but birth to 3 insurance, we were never billing private insurance, or if we were not a preferred provider, so we were not able to get anything in. So as we get people with private insurance, we are going to be able to bill for those services better. And I know that there was one other section that I wanted you to see to not be too worried about. The other piece to not be overly worried about. So under family support, under CLTS MA, we had budgeted that we would take in $575,000. And we had $60,000 that came in. The reason, that's kind of a pass-through. So we kind of budget for that much money that has to go out, but then the MA comes right back in and it's a pass-through. So we kind of just have to, we have no idea. Like if we're gonna have some really big expenses of needing to put in a new fence or a couple of new disabled bathrooms within somebody's homes, those things cost quite a bit of money. So but they're 100% reimbursed. So I just wanted to let you know that some of these numbers are on there, but they're not necessarily that we didn't get, the revenue is not that important because if we got back exactly what we spent. If that makes sense. Is that kind of confusing, the way I said that?
No.
Tweet says yes.
Well, I'm just thinking, you talked about agent of the state, some of that money's a pass-through as well, right? Doesn't some go on to the state?
Yeah, some of that, it's not a one-to-one ratio. Like, we have to still pay for our program. These are like things that we purchase that we just get reimbursed 100% for, versus having staff here. If we had to pay for staff and then didn't get reimbursed for staff, then that would be a little bit different. So I don't know how better to explain it, but that's what I wanted to just point out. It's kind of the key thing in that area.
So this is all 2025.
That's all 2025.
So when will the final done?
Cut off, I don't know, we're still getting, I know that we've just got more money in today.
So the final recap of 2025, when does that happen?
We're getting pretty close, especially on the expense side. There are still some revenues coming in. We'll get one revenue as late, I think it's Gears. The final settlement comes in June. But we'll
We'll have a good idea.
have a pretty good idea, probably
Even by, I don't know, will it be
by
by
next
month?
meeting, yeah. Yeah.
It's
Well,
just, things keep coming in and we try to push them back to that year.
So, Mr. Marker, we got all of our expenses in from our out-of-county placements in 25 now?
that I don't know.
We should, yeah.
Probably by
I
now.
know that I was lagged
The
behind, but the
expenses,
expenses kept.
our bills should be in by now, yes.
Okay.
I'm pretty darn
Because it's
confident on
really
that.
hard if
It's just,
we're looking at 2025, we're already into our 2026 budget, and then we're going to start to
2
think of
months, we'll be looking at
27.
and
27,
it's
yeah.
always this way, this is what happens when you deal with.
And we just got our 24 audit like 3 months ago. So, yeah, in 6 months, you're
Yeah,
dealing
you
with
work
4
in
years.
three, like our fiscal is working in 3 years, 3 different cycles. Sometimes they forget which year they're working in.
But with transitions now being up and operating, we should see a lot less expenses for out-of-county placement.
No,
Is that true? Are you projecting that? I think he is projecting
well,
that.
yeah, when we bring,
Once we're set up and able to take home some of the ones we have
Yeah.
out of county now, yes.
Right, because you're already increasing your salaries for people you're putting over there.
not yet.
Not yet, we haven't.
You're
Basically,
hiring for them.
Well, yeah, we're trying to, but we haven't yet. So we're back on target to where we started when they came over. So yeah, we will do that fairly quickly. And I hear what you're saying, but really transitions is running neutral the way it was. But we're trying to get that staffing and trained up and moving some clients out, and those things are happening in the background. But yes, our projections are based on, not that transitions is brand new functioning, it's that we're able to bring back a client that is high cost. So I guess we just kind of have to talk the same language when it comes to that.
everything we've done to this point has been neutral. We took over the staff from, was it
Northland Council.
Northland Counseling. Because they used to run that whole program. We paid them to run it. Now we took it over. We have the same clients we've had in there, so everything's neutral. What we're trying to do is get to the point where we can bring in our ones that are outsourced now, and that's where we'll save money.
So are they,
Oh, here, I can give you this.
so are they, those needs are gonna be much higher. So that's what you're talking about, having them trained, having certain things, having them have certain certification and those things, because you're talking about those like at Winnebago and in those places, those are the high risk or high need.
Yeah,
And,
we're really focused in on one client at the moment that is out there that's a very high cost. And that'll make a difference.
yeah.
Okay, is there anything else in fiscal that you'd like to discuss?
Nope, I don't have anything else.
Do we have anything under board-appointed committee updates? Anybody? Correspondence reports from conferences and meetings? future agenda items. We did talk about changing our meeting times. And have you discussed with staff anything other, continue that conversation?
Oh, we talked about different days. No, I was thinking the timing still. We talked about potentially a different day,
We
right?
talked about both, the time and the
Yeah, we
day.
were going to look at that.
You were kind of.
We were going to look at the calendar.
And make discuss it with the staff.
Okay, we should add that to the next agenda item.
You also need approval for the staff training.
Oh,
day.
and we need approval for the staff training, yes.
On the next agenda. Anything else anybody wants to talk about? Marshall, Sabrina, anything you want to talk about?
I have nothing.
Okay,
I have nothing either.
okay, thank you. Oh, Dawn, thank you. Let's adjourn. Drive safely, everyone.
Thank you.